and she is been part of this COVID, the whole pandemic of COVID. She's been in and out of it, and she's been working extensively in it. So we thank you, ma'am, for taking out this amount of time for encouraging the young students so that they can really play a very important part. I also welcome Dr. Athura Das, who is who's an accident and emergency doctor, and he is there from Kerala. He's joining us from Kerala, all the way from Kerala, and I think Kerala was one of the first states where it all started from, and it crept through the whole, the first state to actually, to work very extensively during the Corona time. That state had set a model, and we thank you, sir, from Vishwa Yuva Kendra and from Nanal College to be part of this webinar, sir. We also welcome Dr. S. Sushma Jennifer, who is the Assistant Professor, Head of Department of English, to be part of. And I also welcome Ajit Kumar sir, who is from Vishwa Yuva Kendra, and all our other esteemed members of VYK to this webinar. So I think we have a good number of students who are just joining us. So before we start with this webinar, I think the COVID situation in our country is really increasing exponentially, and we see the numbers. We have a lakh number of cases coming up, and people flouting all sorts of social distancing. I think we have taken a back seat. I think we've said that we can beat COVID, I think, but COVID is much more bigger, I think, and it is a result of that we see so many number of cases, and we hear the second wave, the third wave, the fourth wave, and we see the situation. It is a very difficult and grim situation. Of course, in a country like India, it is very difficult to maintain social distancing, but our country is doing at most, to do this. And in this, I think the youth and the CSOs have a very important part to play in this, because, as we know, the young people, be it any sort of disaster or any sort of calamity which is coming into the world, the youngsters are the number one, the first, when we say the first responders, they are young, they are active, you have energy, you have zeal, and this all is a really value add in this world. You have people who have problems, physical problems. You have people who are old age infants, women. You have so many people who have problems, so the young boys and girls, they have a very active role to play. And Vishwa Yuva Kendra is taking this COVID vaccination drive to various colleges and schools around India. And it is really a very important, very campaign that we are, running on. How can we prevent, COVID, increasing, how can we reduce it? And these are by the small measures, So it is very important that it is not just you people who are just listening to all this, I think only when you share this information, which is going to be shared today with your friends, with your family, with everybody, that is when this webinar will be actually a successful webinar. So it is very important that this is not a matter of, this is actually a matter of life and death, that we are facing today. So we, as young people, have to be very, active, and we have to play a very important and crucial role. And when we have such leadership in the college, with father, with the principal, with all the other people as well, it is always a group effort, team effort. So we see how important that the college is taking on COVID, and they think that these hundreds of warriors who are there with us today, they will become warriors, and they will, kind of spread this COVID, myths. They will kind of stop the myths, they will spread the reality, what the do's, the don'ts, So I think we will be talking about all these things, So we welcome all of you once again, and the participants. I think it is very important that you play a very important and key role in this. So once again, on behalf of Vishwa Yuva Kendra, New Delhi, and Nanjil Catholic College of Arts and Science, Tamil Nadu, I welcome you to the webinar on COVID vaccination drive, role of youth and CSOs for social awareness and mass mobilization. Before we head into the with our speakers, I would just want to give our participants, young participants, and our speakers, a brief objective about what VYK is. So I would just like to share the screen. I think Anandji, if I would just like to share a presentation with participants.
Yes, sure. You can share, Rajat.
Sure. Yeah, is it visible?
Yes. Go ahead, Rajat.
Sure. Yeah. So just to give you a brief idea about our VYK. VYK was started in the year 1961 as one of the pioneering youth organizations of our country, and it was founded by our very esteemed people who have given their lives for this country. Like our founder chairman was Shri Moraji Desai, who was the founder chairman. Then we had Shri Ramakrishna Bajaj, who was the founding managing trustee, Srimati Indira Gandhi ji, Shri Navalej Tata, Shri Ravindra Varma, Shri Viren Shah. These were the founding members of our organization. This is Dr. Zakir Hussain, who had inaugurated the Vishwa Yuva Kendra back then. This is our current board of trustees, of Vishwa Yuva Kendra. So basically, our main what we are working in Vishwa Yuva Kendra, what is it known for? It is basically known for two things. It is known for development of the youth and for development of the NGOs, the grassroots level NGOs that we have in the ground. So we are working on that, and we are organizing capacity building programs, workshops, trainings, seminars. Now I think everything is turned online, so we're taking a lot of online as well. So we're doing a lot of activities, and we're working with the community and especially with the youth, both. And we always work on this concept of LNOB, leave no one behind. That each and every part of the country or the society is covered in. So we have our in-house programs here in Delhi. We have a campus here in Chanakyapuri in Delhi. We have various activities, workshops, and trainings and capacity building. Then we have collaborations with institutions on social issues that we have various social awareness initiatives that we are having with various colleges and institutions in India. Then we also have the ICDP program, which is the Integrated Community Development Program that we are conducting in the community. So this is just a small glimpse of our programs. So these are various workshops, various activities, cultural programs, various documentary screening, various disaster management programs, NGO management programs. Then we have various agriculture-based programs. There's a lot of ICDP, the community development programs, health camps, dental check, various education efforts, skill, various such, initiatives are being taken care of. With the colleges as well, like we shared, we are working extensively, and we're working all around India. And we have our facilities here in Delhi, where students come and stay, and where we have the rooms and dormitories for and the dinings, and for all. It is basically a center for the youth, so we expect, also with Nandul College, we have a fruitful and a long association. So thank you so much for this. So without taking too much of time, without taking too much of time, I would now like to, invite Reverend Father Michael, Secretary and Correspondent of Nandul College of Arts and Science, to kindly give
That's
the
very
introduction about the college and social initiatives that are being undertaken by the college. Yeah. Over to you, Father.
Thank you, Thomas. Thank you. Dear friends, very happy to be part of this program today. And I would like to appreciate Mr. Thomas. He only took this initiative of COVID-19 vaccination drive, role of youth and CSOs for social awareness and mass mobilization. And I really thank Vishwa Kendra for organizing this program. First of all, I would like to introduce myself. I am Father Eckermans Michael, Secretary and Correspondent of this college. You know, this college belongs to the Roman Catholic Diocese, that is the Latin Diocese of Kuliturai, and it's a Catholic minority institution. We have 88 qualified teaching and 37 non-teaching staff working here. And we have such a wonderful personality, Dr. Meenakshi Sundarajan, as the principal. We have almost 2,000 students from Tamil Nadu and Kerala studying here, because our college is located exactly in the border of Kerala. One of our gate is Tamil Nadu, the other gate is Kerala. You know, in such a way it is located. During this COVID lockdown, I myself took initiative of giving awareness to all our college students of how to take preventive methods and all those things. So I'm happy that today different doctors from different areas, they are also giving this kind of awareness. Doctor, special thanks to you, Soumya Mehta and Dr. Artudas and all these people. So Thomas, thank you so much for giving the college also an opportunity to take part of this. Yeah, thank you and God bless you. And we'll give all our supports, and whatever you need, we are ready to offer any kind of a support. God bless your work. Keep up the good work. Thank you.
Thank you so much, sir. Thank you so much. I think this is not just, I think we ourselves, we are being motivated by our young dynamic director who is not here with us today. Mr. Uday Shankar Singh, he is the Chief Controller of Vishwa Yuva Kendra. He is not with us because he has some urgent meeting coming up. And we also have our management of Vishwa Yuva Kendra, without which we are not, only with their active support are we able to, reach out to colleges like yours, So it's because of all these and as together as VYK that we are able to do this.
Thank you.
Yeah.
So, to the principal.
Thank you. Yeah, sure. So we now welcome Dr. A. Meenakshi Sundarajan, Principal of Nandal College of Arts and Science, to kindly facilitate. Yeah.
Mr. Thomas, resource person of the seminar, Dr. Soumya Mehta and Dr. M. Mathura Das, participants of the seminar. Actually, I really thankful to Mr. Thomas for giving me giving the opportunity to organize this seminar with the cooperation of Vishwa Yuva Kendra. Last week, he contacted me over the phone to organize this nice seminar. We immediately, with the help of the secretary, I immediately accepted. And we appointed one Thomas from our college as a coordinator of this seminar. Actually, we thank him for mobilizing with a short span of time. We could mobilize nearly 400 students to participate in this. Because the COVID period, the college is closed, students are not coming to the college. In spite of that, we contact all the students, especially second year and second PG students, to attend this program because examinations going on for them. For other students, internal examinations are going on, so they are not able to participate today. But actually, the topic is a burning topic now. Every year, actually, when we thought COVID first period is over, the country as a whole is normal, we thought, and every process to be started. But unfortunately, second COVID starts last week onwards. Really, 7 states are badly affected. Whole India, nearly 150 patients are severely affected by the COVID. But even though the government has given many advertisements and publicities, but whether the people follows it or not. Why I think Thomas selected these colleges? This is a route of the society. The student is the root of the society. When we created awareness among the students, automatically it will reach the homes, not only home in the inside marriage. So, how to prevent the COVID? First one is the knowledge of COVID. What is the knowledge? And even I am the principal of the college, whether the injection, whether it's effective or not. Actually, the government actually has given advertisement, publicity. You should take at least 2 injections. First one injection, then after 2 weeks you have to take another injection. Whether it is essential or not, to whom it is essential. It is first one is. Second is how to prevent. That is a very important. After attacking the COVID, before that we have to take the preventive measures. So what type of preventive measures we have to take? I think this seminar would be highly useful, not only for the college teachers, but also for the students. If there are students from our colleges near rural area, Kaliyakal is a rural area, Mr. Thomas in Delhi, metropolitan city, it is a rural area. So he is connecting Kanyakumari with the Delhi. Kaliyakal is in Kanyakumari district, he is connecting with the Kanyakumari district with the Delhi. So this seminar would be highly useful to the students public. I really appreciate the efforts taken by the Thomas for arranging the nice seminar. Anytime you contact me for organizing this type of program, the college is willing to organize this type of program. But actually, we conducted the seminar 1 month back about the seminar. Actually, our father was a resource person. We have collected the information from the newspapers or journal, what we have to take. Even the students enter the college, they should wear the mask, they should wash their hands, then only we allow the students to enter the college. So even the home, inside the homes, whether they are following the practices. When they are traveling, when they are speaking with the people, when they are comparing to the students, whether the people follow is or not. So I think this webinar would be highly useful to the students, how to follow it. They are all youth, their age is in between 17 to 19. The age is actually 17 to 19. The second COVID I heard about, it normally affects the young generation. In the first COVID, normally affected the old generations. Now the young generation, the COVID also spread to young generation at the age group of 15 to 35 also. So they should be very careful. I think the webinar will be very highly useful to our students. I request our students to follow it very strictly and to follow it. And you should spread to the public. That is very important. The purpose of webinar, not only to you, my dear students, you have to educate the in and around the people. In around the people, in around the village, to educate about the impact of COVID, not only for health, but also economy as a whole, but affect India as a whole, world as a whole. Actually, in those times, it was cholera. Cholera was an epidemic which spread throughout the village and the complete village was fine. Second, after the 100 years of gap, just the COVID is another dangerous disease is there. So, my dear students, this webinar will be highly useful to you. Actually, they have selected very highly resourceful persons. They are going to deliver a lecture about this. You please hear it. You please ask any doubts. Please clarify it. I think that only the seminar webinar will be highly useful. Thank you very much. Thank you all. Thank you.
Thank you so much, sir. I think by giving in your support, with your college, with the students, I think this shows that I think it really matters to you that your students are learning something new, and they are going to be part of this pandemic, fighting it out. And we really appreciate, sir, the social initiatives which are taken by the college, are really commendable. And we thank you, sir. I think because of colleges like you, that we have young, educated, young, positive minds coming out of the college. So we thank you once again. We thank both of you. Now, thank you so much. So now we move to the main part of our webinar, why we are here, and as we are seeing the various waves of COVID, going through our country, and all over the world. I think the situation is not just dull in India, but the situation is really grim in the other parts of the world. So we have to be a source of encouragement we have to be a source of encouragement for those in need. We have to be smiling. We have to be positive. I think if I think people who are, in distress, I think if we give distress back, it will be very difficult for them. So I think it is very important for us to be positive, to be smiling, so that we bring out some joy. So before we start with the speakers, I would just want to give some instructions to the students. We have the two speakers, with us, and if you have any sort of questions that you want to put to the speaker, either of the speakers, there is a question and answer box. If you see the bottom part of your screen, there is a question and answer box. You may kindly put your questions in that question answer box. I'm repeating once again, any sort of doubts, because it is very important that if you have any doubts, you can put it in the question answer box. It is only for questions. And then we have the chat box as well. If you want to share anything important, or if you want to put in any other information, you can put it in the chat box. But the chat box is only meant for sharing information, and the QA is for the question answer. So I request the students and the teachers and all the participants and the NGOs to put their questions in the question answer box. I would also request you, those who are not able to join us through the Zoom, we have the webinar live on YouTube as well. If you go to the Vishwa Yuva Kendra page, you may find that, and you may subscribe the YouTube channel of Vishwa Yuva Kendra page to get further updates for that. So I request all the students to kindly subscribe to the Facebook page or the YouTube page of VYK for that. So we will be taking up the question answers after we have the speakers. So now I welcome Dr. Soumya, who is our first speaker. If I request Anandji to kindly share the profile of Dr. Soumya on the screen. Yeah. So Dr. Soumya Mehta is basically, she is a resident doctor at JIMS and the clinical research consultant at the COVID-19 registry. And she has been in the COVID ward during the whole of the pandemic. She's also been working at the Sun Parmanand Hospital, and she's been part of the surgical ICU department. She's also worked with the BL Kapoor Super Speciality Hospital at the Department of Neurosurgery. She's also been part of the International Epidemiological Association, Southeast Asia, hosted and attended the workshop and training on non-communicable diseases. She's also been part of the Public Health Foundation of India 2021 activities and fighting COVID-19, translating knowledge into action on their workshops. And she's also been part of workshops organized by the WHO on COVID-19 operational planning guidelines to support country preparedness and response, and COVID-19 vaccination training for health workers. So we welcome you, ma'am, for this webinar. And as I was looking at your profile, ma'am, you are really a very apt person for this webinar, because you yourself are a very young person, a young doctor. So I hope you can share with the students and motivate them. And I hope there can be some sort of learning for the students, because this is actually a matter of life and death. So we look forward to hearing from you, ma'am. Over to you. Thank you so much, ma'am.
Thank you so much, Mr. Thomas. First of all, good morning to one and all present here. A special hello to all the students who are listening to me. And it's great to reach out to so many people through this platform. So thank you so much for the opportunity. And thank you so much for the wonderful introduction. It was nice hearing all those things about myself. So thank you so much for having me once again. So before I begin with the COVID vaccination and the do's and don'ts and everything, let's just quickly look at the COVID-19 timeline in India. So the first case in India was presented in January 2020. And then the nationwide lockdown was imposed on 25th of March 2020. And WHO declared this as a global emergency of international concern. And soon it was declared as a pandemic, which is an epidemic which is spread across various countries and continents. And most people do not have immunity against it. And now, almost an year later, India is experiencing a renewed surge in cases in many states. Also, from the first case in India, we've come a long way now, and till to vaccination. And right now, India is running the world's largest vaccination drive with around 7 crore 87 lakh people who have received a single dose of vaccine, which is about 5.8% of the total population. And 1 crore 14 lakh people are fully vaccinated. That is not even 1% of India's population. So my point is that the number of people who are being vaccinated right now is not enough when we look at the number of cases. So in India, last year, what all happened, the way the cases have risen and the lives we've lost, I don't want to get into the statistics because they're scary and they're depressing. Right now, I think our focus should be on the current vaccination program that's running in the country. And we should encourage more and more people to get vaccinated. We should encourage the youth uh, to spread awareness and to be fully aware themselves, to have the correct knowledge, and to spread it to other people as well. Because I see there's a lot of wrong information, a lot of rumors that's going on through WhatsApp or through Facebook or other social media handles, and our parents and grandparents are more glued to their mobile phones than we are, and they absolutely follow and believe whatever comes to them as a forwarded message. So I think it's very, very important that we stop it right there without having complete and correct information about a particular topic. We should just tell them and encourage them not to, forward those messages to other people and spread fear and an atmosphere of disappointment or, fear amongst people. As it is, there's been a lot of stress since last year because of the situation. People have lost lives. People have had to stay alone because of the lockdown, which has caused a lot of emotional, physical, financial stress on people. So there's a lot of negativity already uh, associated with this. So it's just important that we look at the whole situation from a positive point of view, learn from the pandemic, and then move ahead. Okay, now when you ask me about people who should not get vaccinated, that is, who should not get the vaccine, as per the rules stated by the government, uh, one, pregnant women and women who are breastfeeding, that is, lactating women, should not get vaccinated. The reason being that there is not enough research on the effect of vaccine on the baby that's there in the womb of the woman, or the vaccine that might be passed on to the child through the mother's milk. So, because there is not enough research, that is why pregnant women and women who are breastfeeding should avoid getting vaccinated as of now. Then, secondly, children. This vaccine has not yet been tested on children. The trials are going on, they are in the process. So, children should not yet get vaccinated. Thirdly, people who have developed anaphylactic reaction against the first dose. Now, it is important that you understand the difference between allergy, a normal allergy, and anaphylactic reaction. Okay. Uh, there is a response that is generated by the vaccine, which is normal. And there is an extreme type of response, which we call anaphylaxis. Now, anaphylaxis will be will have symptoms like swelling of the face, swelling of your limbs. Then there's this redness on the face, which is called hives. There's breathing difficulty. Basically, reactions which would get you to the hospital and get you admitted. Those extreme type of reactions are called anaphylaxis. So people who have developed anaphylaxis against the first dose should not get the second dose. Then, fourthly, patients who are presently COVID positive. Now, there are two ways that you can develop antibodies against COVID. One is by getting infected, and the other is by getting the vaccine. Okay, so people who are already infected, people who are already COVID positive, are already developing antibodies against the virus. All right, so people who are currently positive should avoid getting the vaccine. For them, the vaccine is deferred to a few days. They should, in any case, get the vaccine, but after they are completely healed and after they are healthy, a few days after that, they should get the vaccine. So the vaccine will act like a booster dose for the people who are already infected. All right. Now, the last point that I would like to add, it's not by the government, but this is I'm going to say this from a personal experience. People who have anxiety or fear against the vaccine. Now I say this because if you're already anxious and if you're already scared about getting the vaccine shot, then you will raise your BP. And once you reach the vaccination site and you look at the needle, you will be all the more scared. You will be scared of what might happen to you, and that will further increase your BP and get you to a problematic situation. So I would suggest, if you have any doubts, any anxiety, or any fear related to the vaccine, I would advise you to please speak to your doctors and counsel you uh, to get the vaccine and get the fear out before you actually go and get the shot. Then these are the people who should not get vaccinated. Otherwise, everyone else should and must get vaccinated. I urge everyone else who are above 60, people with other ailments like cancers or heart diseases or hypertension or diabetes or people who are on people with mental disorders, people who are physically handicapped, people who have complicated diabetes or other complications of hypertension, people who have had heart surgeries, even them, they can get vaccinated. Both the vaccines are absolutely safe. Now, the other issue that's been rising is which one is better, Covaxin or Covishield, and which one is more effective. I will get to that later on. But as of now, please understand that the vaccine is absolutely safe for these people. In fact, uh, this is the targeted audience right now. These are the people that we need to save. These are the people that are more susceptible to having a more serious disease if they get infected with COVID. That is all these comorbidities that I have listed. This is the target audience. These are the people that we really need to get vaccinated. So if the rumors are coming around that people these people should not get vaccinated, people with heart surgeries should not get vaccinated, I think that's complete nonsense. Please do not follow that. In fact, these are the people that we need to save. Now, things that you need to keep in mind before you go for vaccination. First of all, like I mentioned, please get the anxiety out of your mind. Please get the fear out. Please talk to someone who's already vaccinated around you, or talk to your doctors if you're not convinced by them. First of all, get the anxiety out. Secondly, people who have BP issues already, people who are on medications for BP, please take your medication the day you go for vaccine. please take your medication a day before and a day before, like whatever your normal routine of taking the medication is. So on the day of the vaccine, your BP should be under control. Before you get the shot, please get your BP and RBS checked. RBS is the random blood sugar. People who have diabetes should get their RBS checked on the day of the vaccine. We've been doing that in our hospital. We're checking the BP and the RBS, especially for people who are above 50, and for people who have a history of hypertension and diabetes. So these two things, being the most common ones, should be kept under control: BP and RBS. In case at the time of vaccine your BP is high, you should please wait for some time, or your RBS is high, you should please wait for some time till the values get to normal, and then get vaccinated. Probably come another day and then get vaccinated. Then there's a lot of rumor, and there's a lot of controversy going on about people with heart issues. So we've seen a few deaths that have occurred post vaccination. Now the causes of those deaths could be varied. It requires a long investigation. You cannot just say that a person died because of vaccination. There could be a lot of other underlying conditions that we still don't know about. So when you read headlines like so many people have lost lives because of after getting the COVID vaccine, please keep this in mind, that what could be the other conditions that those people might be having. There is a possibility that their BP was not under control. There is a possibility that their sugar was not under control. There's a possibility that their blood profile was, deranged, and they had anxiety, which precipitated a heart attack, or an other reaction, which because of which they lost the life. So I think it is very important to keep a check on your health, on your BP, on your sugar, to take your medicines regularly when you have to go for your vaccination, and basically talk to your doctor or your friends, those who have already taken vaccination. Now, when you talk about vaccination, let me first start from the basic. The basic concept of giving a vaccine is to prepare the body to fight against a particular disease. Like we've seen with little babies, newborn babies in India, they're given BCG vaccine or polio vaccine and DPT, and so this is, I think, this is the first time that the adults are being vaccinated at such a large numbers. Otherwise, the adult vaccine that is given is tetanus, maybe, or flu shots. A few people are getting nowadays. So that is why this whole anxiety and this whole discussion has developed, because it is the first time that the adults are getting vaccinated in large numbers, and because we're dealing with an unknown, or a lesser known pathogen. So my point is that when we take our little babies for vaccination and we inject them with live viruses, we do not think so much, right? We trust our doctors, we trust our pediatricians, and we trust the fact that the injection that the babies are being given will protect them. So the same logic applies here. Please trust your doctors, and please trust the scientists, the agencies that have worked all these months to bring out the vaccine to you. And so many other agencies are still working at it, and they've come up with this. And the vaccines go through a lot of levels of approval and trials before it is brought out to people. So please trust the whole process. Please trust the doctors. We've all been vaccinated, the frontline workers, the doctors, and we're absolutely fine. So now, talking about the vaccine, uh, the the main agenda of getting the vaccine is to prepare your body to fight a particular infection. Now, what that means is you're injecting either a dead virus or a live virus or a part of the virus into the body. The body will recognize a foreign pathogen entering your body, and it will develop a response against it. It will, which is called the immune response. Okay, it will develop a response against it. Now, the process of developing that response will cause fever, will cause body ache, will cause maybe joint pains, or may not cause any symptoms at all. So the response that most people are getting after vaccination, that is, some people are developing fever, some people are getting a feeling of tiredness, or joint pains, uh, or anything like that, or mild itching at the injection site, or redness at the injection site, or a lumpy feeling. You know, these are all normal responses of the body. So please do not be scared of this response. When, please remember, those who have babies and got them vaccinated, even those babies develop these kind of reactions after they're vaccinated. So please don't be scared about these little mild reactions that your body gives after getting the shot. It is absolutely normal. When you should worry is when you develop a breathing difficulty. That is the anaphylaxis that I was talking about, and that usually develops within the first 4 hours of getting the vaccine. So now, when we inject the vaccine, the body response will be this, and the body will develop antibodies to fight against that particular virus. Eventually, the vaccine will leave your body, but what remains is the memory. So your body has memory cells. Your body will remember that it had encountered a pathogen like that previously. So when the next time you actually encounter the infection, your body will be better prepared to fight against it. I'm not saying that you will not get infection after getting the vaccine. I am saying that your body will be better prepared to fight against it. I am saying that the chances of COVID developing into a very serious disease, the chances of hospitalization, the chances of losing a life because of COVID will significantly come down. That is what the vaccine is going to do to you. It is basically going to prepare you, to prepare your body to fight against the disease. So this is the point of the vaccine. And secondly, what I want to say is it will you. So basically, you should not just get the vaccine to protect yourself, but also to protect others. So when a lot of people are vaccinated, we will reach the herd immunity when, say, about 70-75% of India's population is vaccinated. We'll reach to a level of herd immunity, and that will break the cycle of transmission of disease. So the chances of you transmitting a disease to the other person will significantly fall once you're vaccinated. So please get the vaccine. Please encourage others to get the vaccine, and please shed all the fears and the anxiety issues. Please get the correct information regarding the vaccine and how it works, and your current status, your health status, and please work accordingly to ensure health of yourselves and health of the people around. Now, talking about both the vaccines, one is the ones that are available in India, one is Covishield and one is Covaxin. One is developed by Bharat Biotech and the other one is by Serum Institute of India, Pune. So, first of all, I think it's a matter of great pride as Indians that we should all, uh, be very proud of the fact that India has come to a level where we're not just producing our own vaccines, but we're exporting it to the other countries. We're helping out the other countries. So that I think gives us all the more reason to take this vaccine just as a matter of pride. So, so I would like to say that both the vaccines are equally safe. It's not that Covaxin is better or Covishield is better, or just because our prime minister got Covaxin, so this would be better. Because initially the entire rumor was about Covaxin, that Covaxin is not safe. And once our prime minister got Covaxin, now the rumor shifted to Covishield, that Covishield is not safe. So that is not the case. Both the vaccines are equally safe, equally effective. Whatever vaccine is available to you at your nearest place, please go and get it. And if there are any questions or any issue, we'll take that up at the end of the session, I think, or whenever. I will be absolutely ready to answer those questions. Please put forward all your queries and all your questions. So yeah, that's about it. Anything Dr. Das would like to add?
Yeah. I
Can we?
think we would. I think, ma'am. Also,
Okay.
ma'am. Yeah, Atura sir. I think before we, yeah, I think,
Okay.
sir, you will.
Dr. Soumya, you have gone through almost everything. There is nothing else to say, tell about this. You have gone through everything, even without any slides. She has presented everything nice. One or two things is like even after taking vaccine, maybe even after the second dose. That's the point she has to highlight. Like even after taking the second dose, patient may get COVID infection, and we will be only immune only after 2 to 3 weeks time. And even during that time, we should follow the same COVID behaviors, like keeping mask and all. We should follow that. Otherwise, we will definitely get. And one more thing she has pointed out is like, even if you get COVID infection, it won't be that severe when compared to the older wave. That's what I have to add. That's it. Thank you. Very good presentation.
Yeah, I think, Doctor, we would also, like to hear from you, from your perspective as well, how the youth can be an important part of all this, because you being a very young person, a young doctor, because you understand the psychology of a young student or a youngster. So how can like, are they afraid, or they not afraid, or how can they really play a very important role, because we want to know it from you as well, but in particular, how they can be a part of the whole process, pre-COVID, post-COVID, during COVID, you know if you can
Okay.
just give your perspective.
Can I go into my presentation
uh,
directly? Can I go or?
yeah, so we
Okay.
would just like to just hear from I think Dr. Soumya as well a little bit on this, and then we will be proceeding to your presentation. Yeah,
Okay.
so Dr. Soumya.
Okay, thank you so much. So, when we're talking about the youth, I think during the period of the lockdown as well, the youth was the one that was working. Since the elderly people were inside homes, they were under strict lockdown. So, the young people in the families would go out, fetch groceries, and would get medication, and they would, I've heard these beautiful, beautiful stories of young people helping out their neighbors, and being with the elderly around them or in their house. So I think during the lockdown also the young people have worked uh, a lot. They've done their bit, and considering the present situation, I would just like to say that it is important for us youngsters to be fully aware of the whole situation, have a more practical approach instead of being scared and, being just inside our houses and being scared of oh, what would, what might happen. And so just get checked, get updated from the correct sources, not the WhatsApp or Facebook forwards. The correct sources, I mean the government websites, WHO websites, CDC. That's where we doctors get our information. So please use these websites to get correct information, and please spread this information to your parents, to your elderly people, to those around you, and please discourage them from forwarding it, uh, forwarding the wrong information to other people. You should encourage people, the elderly people, to get vaccinated, try and clear their doubts, and even assist them, through the process of vaccination. Because right now the process starts with an online registration, and the older people are not so tech savvy, so they don't know how to download the COVID app and register themselves and then go for the vaccination. And so I think as young people, we can help them with the registration process, or if somebody is living alone, then you can probably assist them and take them to the vaccination centers and get them vaccinated. And so yeah, that's what I think the youth can do. They can basically spread the correct information and have the correct information, and then pass it on to other people. I think that would be the biggest help right now. And recognize the work that healthcare workers and other frontline workers who've been working tirelessly throughout this. I see a lot of young people, coming to the hospitals and uh, fighting with the doctors and the other healthcare staff, because probably during the initial days, the vaccination process was a little messy, and there was not it was not properly organized. So these people, people don't really have a lot of patience. So sometimes I've seen people coming into the hospitals and fighting. So I think if that can be controlled and that can be avoided, so that would be a big help.
Sure, sure. And also, Soumya, also because we have a lot of because this webinar that we have is basically for the youth and for the CSOs, the civil society organizations, the NGOs, the grassroots, we have in all the the least reached areas. How do the NGOs also, how do they play a very important part? Because we see, we always say that it is itself a very big important aspect of our country, the NGOs who are doing the work similar to the government, to the doctors, to the engineers. So if you can also, Soumya ji, just add to it, and after that, sir, we will just proceed, sir.
Or can we go after the presentation?
Sure.
It will be good.
Sure.
So it will be.
Sure.
Or it will be almost same repetition.
Sure. So if I would just request, if Anandji, if you can just put Dr. Athura Das's profile on this on the screen. Yeah. So first of all, we welcome Dr. M. Athura Das. I think, sir, welcome to this webinar. I think sir has, this is not the first time that sir is being part of Vishwa Yuva Kendra activities. I think regularly during the disaster management programs that we have been conducting in the southern part of India, I think sir has always been a very strong sort of support to us, to the youth, to the NGOs. So we once again, sir, we welcome you to this August webinar, sir. And sir, this is a very short profile of sir. Actually, he's an MBBS, MD, Accident and Emergency Medicine, PG, DFM, CMC, Vellore, FICM, FAC, and he's a consultant. Presently, he's the consultant in charge for Department of Emergency Medicine, Holy Cross Multi-Speciality Hospital in Kerala. He was awarded the first prize in Trauma Emergency Scientific Paper Presentation on Study of Feasibility Entonox as an anesthetic in emergency medicine. Trauma 2019, Trauma 2009 AIMS at New Delhi. He's the co-author in study on the state of emergency room of medical colleges in India, presented in MCon 2011 in Kolkata, and he won the second prize there. And he's also been recipient of the EPS Star Award, and he is also part of various other medical associations in India. See, we welcome you, sir, to this webinar, sir. Sir, and I hope the youth can really get motivated. I think when sir has taken physical classes with us, I think his class used to be for 1 hour, but it used to extend to almost 3 to 4 hours. I think people I think that's the kind of experience, and sir connects with his participants. So we welcome you, sir, to this webinar. And sir, you have timed, sir, you have almost 35 minutes to take your presentation forward, sir.
Thank you, Rajat. Thank you very much.
Yeah.
And let me go to my presentation. Hello,
Anandji,
can you see this?
No, we can't see the screen. Anandji, have you allowed sir for the presentation? Anandji?
It is already allowed.
It is already allowed. So we are not able to see it on the screen, sir.
Sir, can you please?
Yeah. Now it is there, sir.
No.
Thank you.
Okay, can I go to a screen? The screen. Now, can you see this?
Yeah. It's visible.
Okay.
Sir.
Okay.
Yeah.
Thank you very much, and thank you for the introduction. And Rajat, I also want to thank the college, NNGL Catholic College of Arts and Science, and I thank the management and staff for arranging this program. And my talk is mainly on the power of youth in COVID-19 vaccination drive. So, so in next, I'll be taking only just 20 minutes. And in next 20 minutes, I'll be discussing on a few points like what's the current status of COVID-19 and how to tackle the second surge, and what are the challenges we face in vaccination drive, and where does India stand right now, and what are the role of youth to fight against COVID-19. And we will be talking a few points on the mass vaccination program, which has been announced by our Prime Minister from 11th to 16th. So coming to the current status of COVID-19, as we all know, WHO has declared COVID-19 as pandemic on March 11th, 2020. It has crossed a year since we have faced the pandemic and lockdown. When you go through the history, the most of the pandemic in the history came as multiple waves, infecting and killing more than 2/3 of the population. Here also, the history repeats. Last year, when we had strict protocols, we were wearing masks, we were maintaining social distancing, we had multiple hand washes regularly, and we had a lockdown which we used to sit inside the house. The cases started declining. That is the first wave which started declining. And when the cases started declining, everyone started to throw their mask and they had gatherings, and now it has gone into a second wave. So now we are at the verge of a second wave. The daily rise of COVID cases in India has crossed the milestone of 1 lakh from 20,000 infections in just 25 days. And as per the details from yesterday's website, we have around 1.29 crore confirmed cases of COVID-19 from January to April. That is only this four months, January to April 8th of 2021. And we have a death of 1.66 lakh. And this is the second wave. Here, when you see the wave, you can see the first. You can see the first wave, which is around which was on September 17th, we had around 90,000 cases on that day. And then it gradually declined. And now it is time that it has increased, or it reached around 1,03,000 cases on 5th of April. And the death rate is also slightly increasing. The one thing what we have to see in the second rise is like, in first rise, it took around 108 days to reach around around 1 lakh, and now it had only taken 63 days to reach 1 lakh touch mark, and even we haven't reached the steep. It is still somewhere away, and still we are waiting for the second wave to reach its peak. So the second wave, the problem with the second wave is, the first thing, the patients who are coming with COVID infection, most of them are having severe infections, where they are most of them are getting admitted even to ward or with oxygen, and most of them are with oxygen, most of them are going for ventilator support, and some 30 to 40% are even going to ICUs, and in that around 10% they are going for death also. So in the second wave, when you just examine the second wave, the age pattern, it is hitting the age between 18 to 40. Before, it was on aged group more than 55, they used to get infected. And right now in the second wave, the age is between 18 to 40 years of age. And now India's young are now in clutches of virus. So it is time to fight the next virus. So what is behind the second wave? And recently there was a study from John Hopkins, and they are saying that it is the protocol fatigue. Then how many days we can stay inside the house and wait for virus, not wait and fight against virus inside the house? So how many days you can wear the mask and go to theater? How many days you can go wear the mask and go outside? So this is all the protocol fatigue. Basically the human behavior, as I told before. Initially we were wearing all those masks and all. Now after declining the case and after the introduction of the vaccine, most of them have come to a conclusion that our coronavirus have already left and nothing will happen again. So that's the reason again the coronavirus or the COVID has infected the people. And one more, the other thing which is coming up is mutations, what they say. And even if the patient is having infected with the initial COVID, they are getting second, even with antibodies, they are getting second infections. And one more thing is, we are nowadays we have increased testing facility, so that may be also the reason, but that is okay. And how can we tackle the second surge of COVID-19? There are 5 points where we have to stress as a doctor and as a youth, as a management staff, everyone. There are 5 points. The first and the foremost one is not vaccine, but the COVID appropriate behavior, like wearing masks and maintaining social distancing and hand washing. And I think in most of the TV shows, they used to repeat the same stories only. But even after repeating the same stories, when you go to a market or during the elections, we could find many people even without using any mask or any social distancing. And containment measure is like, if there is a infection in a family or in an area, we have to contain, and we have to make sure that these people does not come outside when they're within the quarantine period. And we have to increase the testing, and we have to increase the RT-PCR testing, so that the people, we will find the cases initially, and either we can treat them initially. And as I told before, the second surge is having lot of ICU patients, and even a step down patients. That means the patient who requires oxygen, and most of them are not able even to stay at home because of their decrease in saturation. So the medical infrastructure should increase. And the last So what is this vaccination drive? So the government of India has taken all necessary steps to ensure that the nation is prepared to face the challenge and threat posed by COVID-19 vaccination. And we have started our national vaccination drive on January 2020, 16th January 2021 across around 3,600 plus vaccination centers all over the India. And the drive is like what vaccination drive means. Vaccination drive prioritizes the health workers, frontline workers, and of above 50. So they prioritize and give the vaccine accordingly. Or if the patient is suffering from certain diseases, they will be prioritized, and they will be given vaccination early. And as we have seen, we have prioritized in some 3 or 4 phases. The phase 1 we used to give to all medical profession or those who are going along with the patients. And the second one is above the age of 60s. And the third, now it has become more than 45. And right now, India has administered around 90 million vaccines across the country as of April 7th story. And in the next 6 months, in India, we are expecting a vaccination of more than 300 million priority groups who are at high risk of getting infected. The mass vaccination is the only safe and reliable method to deal with the pandemic without significant mortality. I again stress significant mortality, without significant mortality. It doesn't mean that if you take vaccine, you will never get COVID. It is that your infection, whatever it is coming, it will be without a significant mortality. And coming to the challenges of vaccination drive, we have, as we told, in next 6 months, they are planning to give for around 300 million people. So for that, we should have a good supply of vaccines. That is our first challenge. And as per the details, I think they are producing around almost equivalent to that. And even if there is a vaccine supply, to get the vaccine with cold chain to the centers, vaccination centers, is other challenge. That and other one is vaccine eagerness. The vaccine eagerness is nothing but the most 80% of the people are ready to take vaccine, but at this point of time, there won't be any vaccines available for, because it is above 45. So there will be a vaccine eagerness, and they will think, oh, now why we should take, and they used to leave. And the other one is vaccine hesitancy. Vaccine hesitancy is like, if the most of the people, they used to, as madam told, they used to follow all the social media, and they used to say, after taking COVID vaccine, 8 people died. After taking vaccination, 2 of them became totally paralyzed. There are many, if you go through or WhatsApp, or there are forwarded messages, there are 101 messages. But the only thing, and that will cause hesitancy whether to take. If I take, if something happens to me, or they feel the thing. So now, where does India stand? India is administering around 10.77 lakh vaccines daily as of now. And we have almost given vaccination for 88 million people, as I told before. And in that, around 77 million people have taken the first dose, and 11 people have even finished their second dose. Coming to the role of youth, we have only 3 weapons with us. The first weapon is COVID appropriate behavior. The second one is increase our testing. And the third weapon is to take vaccines. To support and encourage the appropriate uptake of vaccines, we should have an objective of ensuring all eligible people to receive vaccine with confidence. And they should trust, as Madam told before, they should trust the scientists, the doctors, or then they should not go behind all those social media. They should come with confidence. The hesitancy of public is addressed on COVID-19 vaccination process by, as I told before, there will be a lot of myths and misconceptions where that as a youth, we should try to make that I will go through, try to mobilize the patients and try to get them to do vaccination and to provide correct and timely information regarding new COVID-19 vaccination and vaccination process. And as a youth, we can generate awareness and understanding of phased approach. And it will be like most of them, they want to take, as I told before, 80% of them want to take. But since if everybody goes directly to the hospital, it will be very difficult and there won't be much resources to tackle these people. So that is why they used a phased approach. Initially, doctors, then the outside policemen and fire force and all, then coming to the above 60 years, then 45, then now yesterday's from April 8th, even in Delhi, Arvind Kejriwal has told to give vaccine to everybody and to relax all those phased approach. Because even as I told before, the young people are getting infected more right now. And also, we should encourage them to follow COVID appropriate behaviors to reduce the risk of infection. Then this is what I have already told: provide prompt, simple and focused communication on COVID-19 vaccine and vaccination process. Ensure understanding and acceptance of phased and prioritized approach to everyone to overcome concerns of a population waiting for vaccination, and to build a public confidence on safety and efficacy of new vaccine, and to maintain and sustain key preventive behaviors like wearing mask, maintaining physical distancing and hand washing with soap. This is the thing which I have already told. And in this, the fourth and fifth one is like we need prompt. We have, even if we have a vaccine or we have already taken vaccine, we have the continuation and reinforcement of the COVID appropriate behaviors, and we have to go for a prompt testing and prompt self isolation if they have informed isolation. So coming to our role as NGO or youth, the main thing is like social mobilization action which will focus on the risk communication and community engagement. It will respond to perceptions of communities and health service providers on COVID-19 vaccines. Ensure that all people perceive and understand the vaccine process correctly and act accordingly. So the mobilization plan is like, as I told before, phased vaccination plan. Address the NGOs should address the vaccine eagerness, and they should have patience to wait till their turn, and they should have multiple conferences or multiple talks on vaccine hesitancy, and they should encourage the people to take vaccine. And the social mobilization action will motivate the priority groups for COVID vaccination and their family through community consultations and interpersonal communication during house visits. And these there are many things, and the main thing is like social mobilization activities, which includes the community meetings, participatory activities, traditional media group performances, rallies, talk show, mic announcement, road show, whatever possible. We have to the NGOs, whatever the NGOs, they are able to do, they have to do and promote vaccination. The interpersonal communication and group consultation will be organized for frontline functionaries and local influencers to engage the people to dispel misconceptions and fears regarding the vaccination process. And also they can, even NGOs can make certain communication materials and tools like posters, banners, leaflet, pamphlets, FAQs, and interactive videos, which can be widely used for easy communication to motivate the vaccination drive. And coming to the last thing is like our Prime Minister Narendra Modi have urged the youth to come forward and help the senior citizen and others who need help to register. As Madam told before, most of the seniors, they doesn't know how to register it's very difficult for them to download an app and all. So we have to, as a youth, we have to come forward and help them. And if they need any help, or they want us to take or the NGOs to take a role of taking them to the hospital. And as we know, most of the aged group people, they are not taken care much, and most of them are even in this one the old age homes and or even the NGOs can take care of some one or the other old age homes, and they can arrange. And as IMA, we are arranging in Kollam recent, maybe in this 11th, we are arranging a mass vaccination program in our area. And like that, you can also arrange associating with your doctor who is in charge and of that area. And also you can gather a different type of people, and you can accelerate the vaccination. And PM has also stressed on the need to create micro containment zones, because if there are people they are already infected, they should be in a contained area to effectively contain effectively reduce the rising cases of COVID-19. And he has also in yesterday's CM meeting, our Prime Minister has also focused on testing, tracking the cases, treating them properly, and following COVID appropriate behavior and COVID management, and to reduce the mortality rate in the coming second wave. And never forget, the young people in India are capable to take the country out of shackles of ongoing health and humanitarian crisis. So take care. Thank you. Thank you very much.
Thank you so much, Doctor. Thank you so much. I think really shared very important information, and that too very categorically. So we thank you, Doctor, for taking in so much of effort. I think we should, really appreciate Dr. Das. He's in the hospital, he's working, but he's still taking out time for us. So on behalf of VYK and Nandal College, we thank you, sir, for sharing your information, sir, and guiding this youngsters and this NGOs as well. So, sir, now I think we would request both our speakers to be there. Now we would request Dr. Sushma Jennifer from the college to kindly, there are some queries that the students have. I think we have a lot of queries that the students have posted to us. So if I may request Dr. Sushma, yeah, welcome. Yeah.
Hello?
Yeah, you're audible.
A very good afternoon to you all. Really, it's a very wonderful session. This National Catholic College of Arts and Science have arranged so many programs or awareness program concentrating on the COVID awareness, providing awareness not only for the students, but also for the environment, all the other peoples. Okay, I should thank everybody, but before that, let's go into the questions. I have a few questions over here. And one important question is, and it is addressed addressed to Dr. Soumya Meha, and it is saying that, ma'am, can you explain about the side effects of the vaccination? Is there any side effects for this vaccination? And if so, what will be the side effects because of getting this vaccination?
Okay. I think I've talked about this during my time. Vaccination, I would not really call them side effects. Okay. Those are the normal effects, or it is the normal response that the body shows towards any foreign pathogen that is entering your body. So when the vaccine is given, there could be a response from the body which will include a rise in body temperature. There could be a fever. There could be joint pains. There could be generalized body pain. There could be a feeling of tiredness or weakness, but that lasts for about, or at the injection site, there could be redness, there could be swelling, there could be a small lump, or there could be a rash that might develop. Okay, but these reactions or these responses are absolutely normal when a foreign pathogen is injected in the body. So you can't call them side effects really, but that's the normal response. That's how your body deals with a foreign pathogen that's entering the body. So these could be the reactions that you can see when once you get the vaccine. And in order to treat that, I think paracetamol, a tablet of paracetamol, either once or twice a day, would work very effectively. That's what we've been giving to the people in our hospitals who are coming for vaccination. And these reactions will only last for a few hours, or maybe a day, or maximum for two, not more than that. So there's no need to be scared of slight fever or a rash or slight pain. Like for example, I when I got my first shot, I developed a mild fever in the evening, and I took a paracetamol, and I was fine the next day morning. And after my second shot, I was absolutely fine. I did not have any reaction. So some people might have a reaction after the first dose. Some people might have a reaction after the second dose. Some people might have a reaction after each dose, or some people may not even have a reaction at all. And all of those cases are absolutely normal and absolutely fine, and there's nothing to worry about.
All right. Thank you, doctor. And in your initial presentation itself, you told that even if your baby is getting vaccinated, they will be having such symptoms like
right.
fever and all. Okay. So we have to understand that these are the impacts, so that we can understand that the vaccination is still working in our body.
Right.
All right. Thank you, doctor. One other question. They have asked that, can you please say how long does the vaccine affect in our body? How long this will stay in our body?
Okay. The vaccine itself doesn't stay in your body for a very long time. But like I said, the vaccine will generate a response. The vaccine will get your memory cells in the body activated. So the next time when you encounter such an infection, your body will remember that it had encountered a virus like this earlier, and it will immediately bring up its defenses and be ready to fight the infection. Now, see, the researchers are not yet enough. We don't have enough literature, enough information to say up till what time it is going to provide protection. Okay, because the virus is new and the vaccine has recently come up, so we need to give it time to be able to decide up till what time it will provide protection. So that time exactly we don't know, but we do know that our body will remember. The memory cells in the body will remember what it had encountered. Please remember that the body has memory. it's going to remember. So please get vaccinated. See, there are just two ways to have antibodies in your body. One is by getting infected, which is a horrible way, and the other is by getting inoculated. By getting the vaccine done. So vaccination is the only safe option that we have left with us in order to generate antibodies in our body.
All right, thank you, Doctor. One question for Dr. Athura Das. Okay, so the question is, when will the vaccine be available for, that is, starting from 18 to 35 years of old? And is our government paying for COVID-19 vaccines? And they have one more doubt, that they are funding schemes for NGOs or for fighting against this COVID, CSOs.
Okay. Okay. Thank you, madam. Okay, the first thing is like when you will get the vaccine. So right now, we are giving only above 45 years of age. And definitely, maybe after in this vaccination mela, what they are like from 11th to 16th, they are maybe they are planning to take. Till now, we didn't get any details from the government. And if they are, if right now we are giving spot registrations for the age group above 40 years, or the patient, if the patient is having any sorts of illness or any comorbidities, we are definitely giving. Then the second question is whether the government is paying for it. Yes, government is paying for it, because the vaccine itself will cost. If you go and purchase from an outside, if it is right now, it is not available, and maybe in a later stage, if it may be available. There will be a stage when it will be available in a medical store. That time it will be at a cost of more than like chickenpox vaccine. It is costing around 2,000 rupees. Later it will be something like that also. So government is giving us in a subsidized rate in private hospitals. And even in government hospitals, most of them are getting vaccinated even without paying that 250 rupees. Government has kept a small amount of 250 rupees. And even I think the NGOs, even if they are willing, they can, if the patients are they doesn't have any money, or if there is an old age home where they doesn't have any money, definitely any of the NGOs can take 250 rupees per person, and they can be given vaccination from their cost. And right now in government hospital, they are most of them, they are not charging any anything. And third question is can NGO? Third
Is
question.
there any funding schemes for the NGOs for the fighting against?
So as of now, there are no funding schemes as such. There are few even when you come to IMA, we are taking few we are taking 150 vaccines. In that 150 vaccines, we are providing free of cost. And for that free of cost, we are collectively we are paying directly to them. And we are actually for resources, like for whole, we need some money. It should be in a systematic way. There should be a hall, there should be a waiting area, there should be an observation area in a vaccination area site. There should if something happens, and any, as madam told, if there is any anaphylactic reaction, and we have to tackle that on spot, so we need an anaphylactic kit. We may need an oxygen. So most of the time it will be very difficult to arrange in another scenario. But in a hospital scenario, definitely we can NGOs can arrange, and with the support of the management, they can arrange. And the money, there is no funding as such for this from the government side. The government themselves, they are giving in a subsidized rate. So NGOs can take care of that 250 rupees or something like that, and help them. Thank you very much. Thank you, madam.
Ma'am, if you can unmute yourself, if you can just unmute yourself. Yeah.
Right. Am I audible? Right. So we have one more question. What are the do's and don'ts after vaccination? Can you please explain? Do after vaccination.
Okay. So after vaccination, the do's are going to be the same as before vaccination. That is, like Sir said, we still need to follow COVID appropriate behavior. That is, we still need to mask up. We still need to keep washing our hands frequently. We still need to keep a social distance, uh, avoid gatherings and crowded places, because like I mentioned, that it's not going to avoid, the vaccine will not avoid you getting infected. The vaccine is going to prepare your body for a better response and avoid turning that infection into a serious disease or lead to death. That is what it is going to avoid. The main part, or the major factor, is still going to be your own behavior, your own immunity that is going to act. It is just a booster to your immunity, the vaccine. So the dose are going to be the same. Don'ts, for that matter, you should not uh, say ignore signs of anaphylaxis. You should not ignore any uh, you know fever or any rash. You should definitely take treatment for it. You should not ignore any breathing difficulty that might develop. You should not ignore chest pain that might develop for elderly or middle-aged people. So, and yeah, continue with the COVID appropriate behavior, like Sir mentioned, and especially the youth, because we've seen up till now that the elderly have still been careful. But as the cases dropped, it was the youth or the young people that have, because of, like Sir mentioned, the fatigue, they have probably stopped wearing masks and start going out, having gatherings and get-togethers and all. So I think it's very important for the youth to understand this, that they're not doing this for just themselves, but for others around them, because they are younger and healthier, and they will anyway. For them, it might not turn into a severe disease, but for others, it will. So it's very important for the young people to understand this, that don't wear masks just for yourself, but for others around you.
Yeah, that's rightly said, ma'am. Thank you. Thank you so much.
Yeah, thank you. Thank you so much, Jennifer. I think we have some more questions which have just been posted to us. I think it goes to both our speakers. I think we are living in a very mass digital, age. Wherein is this is mass is the mass digital age helping people to be aware about COVID, or is it creating a havoc? Because there's a lot of misinformation being spread in. There's a lot of, if you see people on Facebook, Instagram, they are back. They're putting posts. People are sharing that we are at XYZ places. Do you think this is an encouragement for the young people to go out, to get out? So I would want to know from both of you, because this is because of our because we are using so much of Google University, we're using Facebook, we're using WhatsApp. So who do we trust? How do we go about it? Because you have people living in the rural areas who still believe that there are a lot of sources of immunity, and that is how so how do we break all these jinx? We being an Indian society, you don't need to take the vaccine. You just take these medicines, these natural medicines, and you'll be fine. So this is a big problem. So we would want both of you, if you can put light to it, I think it will help the youth and the CSOs as well. So.
Okay. Okay. Hello. Can you hear?
Yeah, sure.
Okay. As you told, even in the initial phase only, we had multiple regarding COVID. We had multiple social media things coming up, but we have only one thing to say. If you have any doubt, you can just go and meet your doctor, or you can meet a person who you have multiple ASHA workers or multiple doctors in, and most of the young people, they know one or the other doctor. They can directly ask them, and never ever follow the social media forwards. Like recently there was many details, like if you take vaccine, and one person have one doctor, she has taken vaccine and she took diclofenac, and she died on the other day. You should not take diclofenac or any other painkillers along with this. There are a lot of things which is coming up, but the only thing what we have to tell is, if you have any sort of doubt, you have to talk to your doctor. You can either talk to your doctor, or you have a lot of ASHA workers in and around your surroundings. Definitely you can go and talk to them. And any health professionals, if you have direct contact, definitely you can go and talk to them and clear your doubts directly. And now even in Google, there are few sites like WHO site. WHO sites are there that we can go and we can check the details. And from the WHO site, definitely we have many details regarding that. You can go and see that WHO site, and few other Indian sites are also there. But you can trust WHO site and you can go through whatever you want. And in WHO site, there are FAQs. And if you go through that FAQs, there are almost all doubts which you have will be there on that. Or if you don't have that, you can just type it, or you can send a message. I have a doubt. They will definitely answer you. And never follow forwarded messages. That's what we have to tell. I think Madam can add something else. Thank you.
Yes, I would like to add. First of all, I would like to congratulate Vishwa Yuva Kendra for conducting this whole webinar and reaching out to a lot of young minds. So when we talk about technology, like you mentioned, webinars and programs like these, like the one that you're conducting, I think it's a great initiative towards clearing doubts and bursting myths that people might have. So it's a great way that technology is helping people, and the downside of it, the downside of technology, that is the forwards that people put up, and the messages that's been circulated everywhere through WhatsApp and Facebook and other social media handles. I think that's the one that's just adding more problem to the whole situation right now. So I think if we could control that, if we could discourage and check on people who are forwarding. Sometimes our parents are and our grandparents are guilty of, doing such things. They would read something and they would just forward it to people. So we should stop it right there. Start from our homes, from people around us. And then on the other hand, we should encourage webinars and programs like these in order to reach out to people. That this one is a more logical, more appropriate way to spread information rather than WhatsApp. But unfortunately, this is a slow process as compared to just forwarding a WhatsApp message. So we need to increase these webinars and these interactive sessions and question answer sessions, and put it out on social media and encourage people to share and listen and put up questions, get their doubts cleared from doctors, not by Googling it. Please trust your doctors. They've studied for 6, 7, 10 years, and they have the information that is required to deal with a particular disease. I'm not just saying this with respect to COVID, but for other diseases as well. Please trust your doctors and not Google or WhatsApp. You know.
Sure.
Yeah.
Thank you so much. And we have a question also by one of the students that do we need to wear a mask and avoid close contact with others if we have gotten the 2 doses of the vaccine?
Absolutely, you should and you must, because you have got the vaccine, but you don't know if the other person is vaccinated or not. And like I mentioned, that it is not going to avoid infection. Vaccine is not going to avoid infection. You can still get infected even after 2 doses of vaccination. So you still need to wear your mask, and you still need to maintain a certain distance from people, even after getting the vaccine.
Sure. So we have one last question. The health advisory has stated that those with immunity issues should be cautious about taking the vaccine. So what are the markers of the immunity issues?
See, because vaccine is basically what it does is it will generate an immune response. So people who are immunocompromised, or people who are on steroids or drugs that will bring down their immunity. See, one thing is that these people will be more susceptible to the infection. These people will be more susceptible to that infection turning into a serious disease and eventually leading to death. Okay, these are the people that we need to protect all the more. But at the same time, we need to keep in mind that when these people are vaccinated, the immune response that will be generated by their body will be a little decreased, will not be as much as it would be generated in a healthy body, because they are on immunosuppressants. So the immunity will be lowered. The immune response, which should be generated in a healthy human body, will be less as compared to a normal body in these immunocompromised people. So it is important for such people to talk to their doctors and compare the risks and benefits of getting vaccinated. If the doctor feels that the risk is more, then they should probably avoid. But if the benefit is more, then they should definitely get the vaccine.
Sure. So one last question, by I think we will end the question answer with this. When I think this is for both our panelists, I think when COVID started, when the COVID, the lockdown started, there was a lockdown. When the COVID cases started, coming up, there was a lockdown. But now when the cases are exponentially increasing, why isn't lockdown being imposed now? Was there a need then, or is there a need now? And is lockdown the answer for a permanent kill to this disease? Is the last question. Yeah.
Thank you. So all this lockdown or whatever it is all for like maintaining social distancing, hand washing, everything comes in that last. So appropriate behaviors. So the lockdown is basically for that only. Definitely, if the second wave is rising beyond the first one, definitely there should be a lockdown for at least a minimum of 10 to 15 days. Maybe it will help. And when you just go through the first wave, and first wave, it reached almost just before reaching the peak, the lockdown has started, and from that lockdown, suddenly the cases started reducing. So there are some beneficial effects for lockdown. I mean, that's it.
Sir, the thing is that initially when we had the lockdown for the first time, I think it gave us as a country a chance to prepare ourselves mentally, to prepare the medical system uh, to deal with the pandemic. So that time period where all of us were sitting at homes, the country was preparing its infrastructure and making plans in order to deal with this. And the medical facilities were exponentially escalated, and the testing was increased, and everything was done during the period of lockdown, and we were able to deal with the cases much better as compared to the other countries. Now, when there is an increase in the cases, there might be a possibility of lockdown, but I don't think it would last as long as the previous one did, because we as a country faced a lot of financial loss, and as individuals also, people lost jobs, and there was a financial crisis, and mental and psychological issues. A lot of these issues had come up because of the lockdown. So I think the point of, like Sir said, we need to understand the point of lockdown. The point is to not, go out unnecessarily, and have gatherings, and just go around partying and mingling with people. The point is to uh, stay at home, uh, not go out as much, uh, wash your hands, maintain distance. So if we follow that now as citizens, I think there won't be a need of the lockdown, and people won't have to face so many problems that they had faced during the previous lockdown.
Sure, sure. So I think thank you so much. I think we have had a good number of questions. I think a lot of questions are still there. I would request both our speakers if they can answer to the questions in the question answer box. So it will be really great. And you know it, we once again thank you both. I think you're taking out so much of time, and this information I know and we feel that it will be very valuable for those who are part of it. And do not keep this information just to yourself. That will be a big crime. That will be a big problem. Do not create that problem. Do not be part of this. Spread as much of right information is being shared. Do share it. You can share this video if you're not very clear about what you got. You can just, what you can do is you can go to the YouTube. You can take this video. You can share it with your colleagues, your friends, your family, so that you can get the right information to the right people. So that's very important. So thank you once again. Thank you both our speakers. I think if I can request Ajit ji, Rakesh ji, everybody to switch on Mr. Thomas as well. I would request Father Michael, Dr. Meenakshi, if everybody can be on the screen. We would now like to be coming towards the last and final part of the webinar, which is I would like to request Ms. Tanishka Sharma from Vishwa Yuva Kendra to kindly share with the concluding remarks and the way forward. Over to you, Tanishka.
Thank you, Raja. Thank you so much. I hope I'm audible. All right. Thank you so much. So I am short of words for this webinar and this session of what just I've heard and understood and learned today. Because to be very honest, today I did not feel like one of the organizers. I felt like I'm a participant myself, because there was so much to learn. There were so many questions that were answered, that were made clear, because these questions are doubts to everybody. We all have similar doubts which are related to this vaccine, to COVID-19 disease that's ongoing right now. So, but before concluding, there's just another question in QA which I found really relevant, and I would like one of our panelists to please answer that as well. If very recently someone has got vaccinated for any other disease, and now they need to get vaccinated for COVID, so would that create any problem in their immunity, or maybe, would they do they need some kind of particular gap between the two vaccinations? So could you please guide upon that as well?
They can definitely take the COVID vaccine if they've already taken vaccine for, say, chickenpox or any, or maybe influenza flu shot. But the thing is, like you said, that it is important to give your body some time to generate a response for the other vaccine that you've taken. And then, after a gap, then you take your COVID vaccine so that your body has enough time to, develop a response for both of them. If you take the chickenpox vaccine and then probably in a week's time, if you take the other vaccine, then your body just gets confused and it doesn't have enough time to deal with both the pathogens. So my advice would be to wait for at least a month or two before getting the other shot.
Right. Thank you. Thank you so much, Dr. Mehta. So thank you to both our panelists. The session was great. It was very insightful. It was very informative. And Dr. Soumya, you started with the time. You covered it all. From
Thank you.
the timeline to what is there in headlines today. You covered it all and it was tremendous. It was really beautiful. And to be very live after being vaccinated. But thank you for clearing that it's not just the vaccine effect, but there must be some other problems that people must be dealing before, or maybe ongoing issues they must be having. So it's just not the vaccine. So thank you for clearing that doubt. Also, the encouragement you gave for being vaccinated, that is important for people to know that to stop the disease we all have to be vaccinated. And Dr. Das, Dr. Athura Das, your presentation was really insightful, sir, because you talked about social mobilization plan, you talked about the mass vaccination programs, about the mobilization activities that you, the NGOs, CSOs could take, and they could even participate in it as well. And to be very honest, I think BYK will be their forefront after this webinar to join hands with the NGOs who are working with elderly so that we could help them understand about the registration, about mobilizing them about the vaccine, about COVID-19 disease, and help them clearing their doubts. Thank you so much, sir. Also, I would like to extend my thanks to Nanjal Catholic College of Arts and Science. Their students were very enthusiastic. Their participation is commendable because all the questions are from our very well enthusiastic participants who are present here right now. So thank you to the college, and BYK looks forward to further collaboration. Thank you so much. Over to you, Rajat.
Thank you so much. Thank you so much, Tanishka. I just wanted to share, I think, with the participants that we have the certificate link, which we have put it on the chat box. So all those participants who are there can kindly click on the chat box of the VYK Zoom webinar, and they can click the link, and you may register yourself for the certificates. So all those students who are there, you may kindly find that on the chat box. So thank you, Tanishka. Thank you once again. I would now like to invite Dr. Shushma Jennifer, Assistant Professor, Head of Department English from the Nanjal College of Arts and Science, to kindly share in the future strategies, how we can work together, and also with the vote of thanks as well.
Really, I'm lost of words to thank all these people for arranging such a wonderful session. And I should really thank VYK for arranging such a wonderful, I don't have words. And I really thank our management and also VYK for arranging such a wonderful program and bringing such a great personalities among us and speaking and clearing our doubts, because all our children are young heads, around 18 to 20 years of age, and they are bulging with questions and also doubts, and they have many doubts. Even though we conduct so many programs or awareness programs, we conduct rallies, and we provide more information about, but still they have questions, because this is not an usual in not only for India but also for everybody. It is not a usual thing. So really, I must thank our doctors, our management, VYK, for arranging such a great, wonderful session. It's really a wonderful webinar, and really thank you. And this word gratitude is not only the greatest of all virtues, but we must say that it is a parent of all others also. So if we forget to say a thank you, that will be a great fault on our side. I really understand that. And I do feel that it is my honor to be a part of this webinar, and having an honor to thank such a great personality of souls who serve as an instrument of God in saving the lives of God. And we really, as Nanjal Catholic College of Arts and Science, we really like to have a strong associations with Vishwa Yuva Kendra, and have many useful and essential operations or programs for students and for the society. Nanjal Catholic College has been serving as an instrument in this particular rural area, not only for the students, but also for the people, NGOs, and also other sectors. And we have a strong MSW department, Master of Social Work department, who is strongly associated with the society, and we provide awareness program for all those people also. And this particular program will enlighten our students and help our students to be as a medium between the college and the government, and give a proper awareness for the students, as you were as Prime Minister was requesting, and all the doctors like Soumya Mehta and Anuradhas was asking. Our students definitely will be a medium to take over all your ideas to the society. And we will, as a faculty of this art department, I really promise you that whatever promising efforts can be taken from our students will be definitely taken into hand. And I take this moment to thank everybody. First of all, I really must thank God for providing such a wonderful opportunity, because such a kind of an opportunities are not just facts, but these are all greatest opportunities provided by God Himself, because these opportunities can save lives. As not only doctors, but also many other people are working to save the lives of other people. But I'm happy that our students are made as an instrument, but by you doctors, to save the society, or to save the people in the society, provide knowledge or enlightenment among elderly people, and also illiterate people or urban people, and have a good idea about this. So first of all, I would like to thank Vishwa Yuva Kendra and Nanjal Catholic College of Arts and Science, two special mediums for this. One is Dr. Thomas from Computer Science Department of our college. And I would like to thank Mr. Rajat Thomas for taking so much of initiatives, being behind this program, working with our department in arranging all these things and creating all the backup process. And I don't think so it is a small, simple process. So I especially thank Dr. Rajat Thomas for contacting us and speaking to us and arranging such a wonderful opportunity for our students and people of this locality. Thank you, sir. Thank you so much for your timely cooperation and help in this webinar. Thank you.
Thank you.
Thank you so much. Thank you so much, ma'am. I think the pleasure is ours. And without Father Michael, Dr. Meenakshi, and without Mr. Thomas, of course, who we've been regularly in contact, I think it wouldn't have been done, and especially our speakers. And here at Vishwa Yuva Kendra, we would also like to thank the management and our director and the whole team of VYK and Nanjal College for supporting this. And we hope to take this forward, and finally would like to say, do not keep this information just to yourself. it will be incomplete, it will be a crime. Share this with others, then only you will do justice. So this is the time for us to do something, and let us try and do something. So thank you so much. I think we end right on time, and thank you so much for our speakers and all our esteemed guests. Thank you so much. Have a great day.
Thank you.
Thank you so much. Thank you, Dr. Athura. Thank you,
Thank you
Dr.
for having us and giving us this opportunity to be able to talk to so many people and, spread the correct information regarding COVID and try and end all the rumors and the negative opinions that's been going around. So thank you so much once again. And
Thank you
let's
so
hope
much.
for the best.
Thank you. Thank you. Thank you. Thank you very
so
much.
much. Yeah.
Thank you.
Thank you. Yeah.